Now we know the patient has come with a claudication pain. We have ascertained the history. Now we know that it is an arterial claudication. How are you going to approach this patient? Before we go on to approach this patient clinically, we'll have to some sort of diagnosis, isn't it? So how do you clinically examine this patient? First thing is an examination of the limb. If the patient is presenting with a claudication severe enough, the patient will have skin changes like thinning, shiny skin, loss of hair, brittle nails. These are the changes which you can see. Along with that, you can also see wasting of muscles due to the decreased blood supply. Okay, this is not an intermittent claudication when the patient really comes with a severe claudication. Okay, otherwise, if you examine these patients, if you look at the limb might be almost normal to any other patient, or you may not find any discrepancy between the right and the left limb. Okay, these are the skin changes that can be seen. Next thing is you have to examine the pulses. Pulse examination is starts from the superficial temporal artery, carotid, subclavian, brachial, radial, ulnar, and in lower limbs it's common femoral, popliteal, AT, PT, and DPA. All the pulses has to be ascertained because the patient might be presenting with a lower limb claudication, but there may be a concomitant disease present elsewhere also. It will give you an ideology of what is a possible etiology. It will give you an idea of what could be the severity of the disease also. Okay. Next, we'll come to what is called as an objective measurement. Mere absence of pulse, we cannot say that the patient is having a critical limb ischemia or his patient is having a severe ischemia. So, how do you objectively measure it? Okay. So, to objectively measure, what we call it as an ankle brachial index. Okay. How do you measure ankle brachial index? So, before that, we'll see this one. This is the handheld Doppler machine. Here, what you see is a probe. Okay. It acts something like a B mode of an ultrasound where the electrical signals received are converted into audio signals and you hear through the speaker through it. Okay, here you can see the blood cuff has been released and the Doppler signals are perceived from the dorsalis pedis and you increase the pressure. Okay, first you perceive where there is a pressure, you get a Doppler signal. Usually, classically, what you get is called as a triphasic in a normal artery. It could be bi or monophasic also, but normal is triphasic. So you get a triphasic flow or whatsoever flow here, and then you increase the cuff pressure. When you increase the cuff pressure over a certain period of time or over a point, there will be disappearance of the audible signal. You make a note of it. Okay, that is the pressure in the DP. Likewise, you check in the posterior tibial also. Okay, likewise you check in the posterior tibial also, and then you check in the, say this is the index limb or presenting limb, you check in the PT and DP and check both brachial artery pulse also. Out of these two, whichever has an higher value, you take that, and out of both brachial artery, whichever has a higher value, then you take that. So you put then ankle pressure divided by brachial pressure, you get a ratio what is called as an ankle brachial index. The normal is 1, less than 0.9 is pathological, but we have different severity grade to it. We'll come to it later. Okay, this is how you assess an ankle brachial index. Okay.